I'm Dr. Zalka, founder of Surface Deep. Back acne, truncal acne, it's something that's very common, and I find that patients that come to see me with this problem are often embarrassed. They don't want to tell me that they have acne in a place, they don't want it to be looked at, but it's a common problem, so let's bring it out in the open and talk about it. It's a very common problem. It also shows up particularly in athletes. People that work out a lot, they're in sports, you may be a dancer, you may be a marathon runner. These type of sports can actually cause acne breakouts on the back and chest, and it seems to have to do a little bit with sweating. And it's something that's difficult to treat. Two reasons. One is it's persistent, and it's also a large area. So things that you may get over the counter, creams and lotions and washes, you can use, but it's very difficult to reach back there. So if you're having this problem, I have two suggestions. One is it is good to use certain types of cleanser, not because your skin is dirty or you're not showering properly, but certain types of cleansers I can recommend will actually help prevent the problem. So look for a cleanser that either contains salicylic acid, usually it's 2% salicylic acid, or benzoyl peroxide, somewhere between 2% and 5%. Use this in the shower, on a washcloth or a sponge. You can use either cleanser, and you can actually alternate them. I often have patients use one on Monday, the other one on Tuesday, back to the one on Wednesday, and alternate them. But if you want to just stick with one, that's fine. Use it in the shower as a wash, rinse it off, and that will help. But if you're finding that that's not the solution, you still have the breakouts, see your dermatologist, because this is very easily treated with oral medications. We often give patients antibiotic pills, and this can work very well, and there are other solutions as well. So don't be walking around ashamed of your acne on your back or your butt or your chest, because it's so common and it is easy to treat once you get the right answers.